good morning and good afternoon and good evening. I think we'll get started and greetings to all who are joining us today. And welcome to PAI's Catalyst session. My name is Nabeeha Kazi Hutchins and I'm the president and CEO of PAI. And for those who don't know us or don't know us as well as we'd like you to know us, PAI is a civil society advocacy organization. We're based here in Washington, DC. And for 58 years, we've been champions for universal access to sexual and reproductive health and rights around the world. We advocate to our own government here in the US and also amplify our evidence and calls to action on the global stage. And we're also very committed to expanding the civic space for SRHR advocacy. And in that vein, we support and collaborate with over 120 local advocacy organizations in 36 countries as they further their own domestic priorities to achieve SRHR for their own communities. So I welcome all of you again, and I thank you for your voice and your commitment to our shared cause. Before I introduce our guest, a few housekeeping items. We are recording the session and it will be available publicly. We will share the link with all those who've joined us. Also, if you're on social media, please tag Dr. Foster and PAI, and those handles and hashtags will be added into the chat. We also would absolutely love for you to engage with us on the chat with questions or comments throughout the conversation. And we'll have an opportunity to talk about some of that and what is top of mind for you during this discussion. So today, PAI is honored and proud to have a leader whose groundbreaking research on access to abortion is making headlines. It's also forcing paradigm shifts, and it's fueling new conversations that put the perspectives, aspirations, and experiences of women who make the choice to have an abortion at the forefront. Dr. Greene Foster is a professor at the University of California, San Francisco in the Department of Obstetrics, Gynecology, and Reproductive Sciences, and the Director of Research at Advancing New Standards in Reproductive Health. She's an internationally recognized expert on women's experiences with contraception and abortion, and she's also the principal investigator of the Turnaway Study. Dr. Foster is leading critical and compelling work with an incredible team of scientists and health professionals to answer the question, what happens when women seeking an abortion are turned away? Well, the Turnaway Study has the answers. Her research findings have been featured in the world's leading journals and in her book, The Turnaway Study, which has been received with such acclaim by leaders around the world, including the American feminist Gloria Steinem, who wrote, "If you read only one book about democracy, The Turnaway Study would be it." Why? Because without the power to make decisions about our own bodies, there is no democracy. It's my great pleasure to welcome you, Diana. Thank you so much for being here.
Thank you so much. It's a pleasure to be part of PAI's Catalyst events.
Well, let's get started. I'd love for you to share a little bit about you. Tell us about you. What inspired you or perhaps what outraged you to take the career path that you did as demographer, researcher, author, a lecturer, so many more things and areas that you live in, and specifically around this area of sexual and reproductive health and rights.
So I have a personal deep history of unintended pregnancy in that both my grandmothers became pregnant when they didn't want to be pregnant. One of them it was illegal in the 1930s to have an abortion in the United States, and she went to Puerto Rico and had an illegal abortion. And the other grandmother became pregnant at 19, much to the horror of her very religious Christian family, and she went and placed the child for adoption. And what's unusual about my family's history is not that my grandmothers had unintended pregnancies. I think that many of us have family histories like that. What's unusual is that we talked about it in my family. And so I could wonder, how did those early experiences for my two grandmothers affect their lives? And my father's mother, who had the abortion, came back later, had 3 children that she happily raised. And when she died, we didn't publicly talk about this abortion, but when she died, my grandfather asked that all donations be made to Planned Parenthood because, even though we had not discussed this during her life. But the other grandmother placed my mom for adoption and had such a complicated birth that she couldn't even walk after her delivery. She had no place to go to because her parents were still furious about the pregnancy. And she went home with someone she met at an unwed mother's home. And the brother of that friend raped her because she was already no good. And her life just never quite got back on path. She didn't end up having other kids. She, kind of fought her way to establish herself. And she had an interesting life, but it wasn't easy. And so I was very curious, how are my grandmothers typical? Is the experience of carrying an unwanted pregnancy to term more difficult than having an abortion? And so I was inspired to do this work.
And what a powerful story. You and I had not talked about this piece of it, and I'm glad that you felt comfortable and had the space to share that. But I think it also comes through just now knowing and having that context on not only your research, but also how you tell the human dimensions of the hoops and hurdles and limitations that women and others have to access what is fundamental healthcare. So let's talk about your book, and let's talk about your transformational research in the Turnaway Study. I know this book is on the desk and the bedside tables of so many of us here who've joined us, and certainly at PAI. The book and your research are mind-blowing. I think it challenges the dominant paradigm of what has been perpetuated about having an abortion. So if you wouldn't mind, tell us more about the study and also some of the findings that were either surprising or inspiring to you.
I would love to. This whole chat is such a pleasure, but I am absolutely not used to speaking if I don't have PowerPoint slides. So I'm going to remedy that and show a few slides to help guide the presentation of the results. And of course, we need this awkward moment where I try and figure out how to do a slideshow.
That's all right. You're amongst friends, so all good.
So just a few slides about the effect of access to abortion on women's lives. The Turnaway Study's aim was to describe the mental health, physical health, and socioeconomic consequences of having an abortion versus wanting an abortion and being denied. And in the United States, we've had a narrative that abortion hurts women. And really what we needed was to know what are the consequences of having an abortion, but also let's compare them to the only other option that's available to people who are pregnant when they don't want to be, which is to carry the pregnancy to term. So we did this in the United States by recruiting over 3 years, 2008, 2010, from 30 abortion facilities across the country. And from each place, we recruited people who were just over the limit and were denied, just under the limit and received their abortion. And we followed them for 5 years with semi-annual interviews. And what we found was that this study design really highlights the importance of access to abortion on physical health, well-being of people's families, and the trajectory of people's lives. And in short, what we found is that abortion is actually associated with improved physical health, financial security, aspirational plans, and the ability to take care of existing and future children compared to carrying an unwanted pregnancy to term. And a team of scientists worked on this with me. We published over 50 papers in scientific journals, and then the book that you've highlighted. And we find no evidence of mental health harms from abortion. And in fact, the symptoms of depression and anxiety go down after an unwanted pregnancy, regardless of whether it ends in abortion or in birth. And importantly, probably our most famous statistic is that over 95% of people who receive an abortion say it was the right decision for them. In terms of economic outcomes, we find that women who receive their wanted abortion are more likely than, women who receive an abortion, when we look at women who are denied abortions compared to those who receive one, women who are denied are less likely to be working full-time, more likely to receive public assistance, and despite the public assistance, they're more likely to live in poverty, less likely to have enough money to pay for just basic living needs. And when we look at children's outcomes, children are often the reason people give for wanting to have an abortion is to take care of the children they already have. And what we find is that existing children fare worse in terms of both their economic well-being and their achievement of developmental milestones if their mom is denied an abortion compared to if their mother receives one. We find that the children born of these unwanted pregnancies experience more economic hardship and worse maternal bonding than the children born from subsequent pregnancies to people who received an abortion. And women are more likely to have a planned pregnancy in the next 5 years if they receive an abortion compared to if they carry that pregnancy to term. And finally, and extremely important, is the physical health consequences. Like my grandmother, women who carried pregnancies to term experience much more serious complications than women who receive abortions. We actually had 2 maternal deaths among the women in the study, which is a shockingly high level of maternal mortality. And it really highlights how dangerous and really underappreciated the risk of pregnancy and childbirth are. And that worse physical health is actually seen for years later. Women who carry to term are more likely to report fair or poor physical health over the next 5 years than women who receive an abortion. I've done some work with scientists in other countries. In 5 countries where abortion is legal, we looked at how often people, despite the fact that they should be able to get abortions, are actually turned away, and a little bit of what are the consequences for the people who are turned away. And then with Dr. Mahesh Puri from Kripa in Nepal, where he and I are currently collaborating on an ongoing Turnaway Study for Nepal. But just one slide on our international findings. Here are the rates of denial, women turned away despite the fact that they have presented in a country where abortion should be legal. You can see that being denied an abortion is actually quite common. We found that half of those who were denied a legal abortion went on to get one somewhere else, probably in an illegal way. And up to a third of those who got their abortions elsewhere actually experienced serious complications. So a few international messages: the legal status of abortion, making abortion legal is not enough to guarantee that people can get a wanted abortion. And when people do seek illegal abortions, there can be a high level of morbidity and mortality, but some are actually extremely safe. And we should all remember that unsafe abortion is not the only bad outcome for people who are denied abortions. The risk of physical health complications from delivery is far from trivial. And when we ask people why do they want to have an abortion, all of their concerns are borne out in the experiences of people who are unable to get their abortion. And so from this, we learn that pregnant people can make decisions that are right for themselves and their families. And when we just make their decisions for them, taking away these options will make their lives harder. And so just one little cover shot of the book, and I'll stop my presentation.
It's so fascinating and so powerful what you found in your research, and this piece on who seeks out an abortion and who is denied, I think again just completely changes our paradigm on access, but certainly what the barriers are. And I'd love to talk a little bit about the race factor. You know, you've noted that a high percentage of women who seek an abortion are women who are living in poverty or near poverty. And certainly in the United States, it's disproportionately Black, Brown, Indigenous women who are living in poverty. And I'm curious, from your work and your research, did you see differences based on race and access, turnaway rates, given the overall health equity issues that affect communities of color in the US?
So what we didn't see is differences by race, ethnicity in people's emotional outcomes, in their mental health, and even in their physical health. It's a human experience that being denied an abortion is difficult and makes hardships. Those are shared. What is different is that in the United States, we have massive structural barriers for people having equal access to contraception, for people having equal access to employment. And so people of color are disproportionate and likely to be put in the position where they're experiencing an unwanted pregnancy. So it's not so much that the outcomes are different as found by the Turnaway Study, but that the experience of being put in that position is very different. And I'll say one more thing about that, which is that we didn't find physical health differences. We found some serious complications from delivery and continued pregnancy. And I would like to say that I'm surprised we didn't find worse outcomes for Black women, but we didn't find that. And I don't think that means that it is completely clear from the national data that Black women have higher rates of complication and maternal morbidity from delivery. And this doesn't negate that. It's just not one of the primary findings that we had.
So staying on some of the US pieces of this, given all that is happening here in the United States as it relates to abortion access, the threats to Roe v. Wade, your book is really timely. And so much of the evidence is compelling and very clear. But this fight continues here, and it's becoming even more regressive. I'd love to get your thoughts on what you think that is a cause of. Why is that, and what really concerns you in this moment?
Yeah, I'm so sorry for how timely this book is. When we wrote it, we had no idea that women in the United States would be about to face the first time when abortion is not legally protected at the federal level. So what's going to happen in June of 2022, likely June, but could be earlier, is that the Supreme Court will announce that Roe v. Wade is dead, that no longer is abortion considered a constitutionally protected right, and states can make their own decisions about when to ban abortion. And in that case, about 20 states will ban abortion probably quite quickly. And what we'll see is just, when a right is not guaranteed, some people will be able to navigate their own health and well-being. They'll travel, they'll get abortion pills online, they'll have friends mail them abortion pills from other states. But people who don't have the resources or the knowledge will not be able to do that. And so it will be terrible to see what happens to those people. Do they carry those pregnancies to term? Do they try and do less safe things to end their pregnancy? And this narrative that you can't ban abortion, you can only ban safe abortion, is not accurate. You can ban abortion and people will carry pregnancies to term, and the consequences will be very serious for them. It will, in terms of physical health and in terms of their opportunities to have children later under better circumstances. So we're doing a experiment here where this decision is made for political reasons and ideological reasons, with almost no attention to the data, to the actual impact on people's lives. The Supreme Court, in hearing this case in December, at one point, the Chief Justice Roberts said, "Let's just put the data aside." It's explicit that we are not talking about the real life impact. We're talking about an ideological point that is going to actually be quite harmful.
Yeah, I mean, it's a dismissal of the science. It's a dismissal of agency, and it weighs really heavy on all of us, especially advocates here who've been on this journey for a very long time, and to see this being dismantled and attacked is incredibly disconcerting and, quite frankly, just scary.
We have an opportunity here in this conversation for you to lighten the mood a little bit, because from an international perspective, things are much better than they are in the United States. Internationally, the trajectory has been towards liberalization of abortion laws. Can you tell us a little bit about what some of those, what do we credit those successes?
Yeah, I think the first piece is to recognize what you've noted, is that the overwhelming current international trajectory is toward the legalization of abortion, which is not where things are headed in our country here in the US. And I have to just highlight a point that stands out to me from analysis that the Center for Reproductive Rights has done. And they've noted that since 1994, only 3 countries have actually enacted more restrictive abortion laws. Those are Poland, El Salvador, and Nicaragua. And in the same period, since 1994, 59 countries have actually expanded their laws. And in some countries, as we know, most recently in Argentina, South Korea, and Mexico, these countries have decriminalized abortion. And I'm going to answer your question. Of course, I urge those who are joining us today to also weigh in, because so many of our guests are at the forefront of this abortion access issue and advocacy and research in their own countries. And Eliane, my colleague, is going to post the question from Dr. Greene into the chat that she's asked of me. And so while we hear feedback from our guests, my point of view is I think the countries that you noted in particular, it was a combination of factors and didn't happen overnight. There have been longstanding accountability and advocacy efforts, I think, that have been fueled by local communities and local organizations, and they've been on this journey for decades, for a very long time, right? They brought evidence and research, brought the human impact stories, the clear calls to action, also looking at the arguments from all lenses: human rights, equity, social justice, equality, and more to their arguments. And I think most importantly, whether there was someone who was willing to fund their journey or not, they have remained the course. So it's been incredible sacrifice and commitment to get this right. And I also think that, these past years with the Me Too movement, Black Lives Matter, the visibility around abuses toward women and youth and at-risk communities, all of this also linked to the elevated and very necessary attention around systemic racism and colonialism. They forced a reckoning here in the US, but I think also around the world. And when that happens, it allows people to speak truth to power in new ways that really can't be ignored. I do want to talk a little bit about Mexico, because that is the most recent development, getting a lot of attention, and hearing from our peers and my colleagues and friends there is in Mexico being the second largest Catholic majority country in the world, also happens to be a country that I was raised in, that I call home. And that decision to decriminalize abortion last year was historic. I think so many of us had to take a double take. And on top of that, really pinch ourselves when the Supreme Court of Mexico ruled that criminalization of abortion was unconstitutional. Of course, we all had great hopes, those of us who've been in public health and watching Mexico closely, but I don't know if we all thought it would happen. And so that's a big win. And it's a big signal regionally and across the world, but the work isn't over, because those anti-abortion efforts and campaigns of fear and intimidation and misinformation remain alive and well in Mexico and in countries around the world. And the link back to what's happening in the US, I think it's important for us to acknowledge that all eyes are on us. And of course, state legislation and the decisions that our Supreme Court makes here may seem to only directly impact communities in the United States, but the reality is that what this country does and decides, even for its own people, it reverberates across the world, and it influences anti-abortion, anti-rights, and anti-equality efforts globally. So the threat is very much there, and I think the work is never done, and we all need to come together to make sure that this journey continues.
Can I add one piece? The woman who, the social psychologist who worked on the Turnaway Study's mental health findings, name is Antonia Biggs, and she's Chilean, and she went and testified in the tribunal while Chile was considering removing some of the restrictions on abortion. They had they were considering allowing abortion in cases of rape, incest, and fetal diagnosis. And she testified, and she has since traveled to Mexico City to talk about the mental health consequences, because in Latin America, more than I think now in the United States, the conversation is about the potential for mental health harm of abortion. And so having Dr. Biggs, a Chilean, speak about really rigorous data on this topic has, I think, been quite influential.
Yeah, absolutely, and in spaces maybe where the data is being paid attention to. We had two comments to this question from colleagues on the chat, and one is noting that local feminist activism sustained over decades as a big contributor. And another comment is the mobilization of grassroots organizations and elevation of local voices globally had another big impact. So feel free to share for others who haven't. So I want to go back a little bit to your research, Diana, and it showed you talked about this in the book, but also a lot of peer review papers on this, is how timing is a central factor in who's able to access an abortion and who isn't. All the hoops that the women in the study have had to jump through to pursue a personal decision to have an abortion, I think is a stark reminder of the inequitable and discriminatory policies and systems and ideologies that keep getting in the way. But talk to us a little bit about some of the most difficult hurdles that the women in the study have had to face.
Yeah, timing of abortion seeking is such an important topic, and it really highlights both the individual and structural barriers to accessing care. So one important finding that wasn't really well explored before this study is how late discovery of pregnancy affects people's ability to access care. When you are beyond the first trimester, when you discover you're pregnant, it dramatically reduces your options. You have to travel farther, raise more money, take more time off work. Everything becomes more difficult. And you could say, well, how could someone not realize they're pregnant until the second trimester? It's not super common, but there is just a huge variation in physiological responses to pregnancy. So some people get sick the moment their pregnancy test turns positive, and other people never experience symptoms. And who is particularly slow to recognize pregnancy are young people who've never been pregnant before. They may not recognize the symptoms, or they may just feel invulnerable, that lovely period where you think nothing can hurt you. And then the other group is people who were actually using contraception at the time they conceived. So if you thought you had done everything to protect yourself from pregnancy, you could be slower to recognize that, in fact, you are pregnant. So it's not necessarily that people are sitting around twiddling their thumbs and dragging their feet to get an abortion. There, in fact, can be a physiological explanation for people being late. And then structurally, we make it as difficult as possible to get an abortion in the United States. There are laws passed that actually mandate that you're slowed down, waiting periods to get an abortion, multiple visits, so that you can't just go to your appointment. You have to go, wait, and come back again. And then there is an example of a woman in the book who repeatedly tried to get sterilization. And she, at each delivery, so I think she had 4 kids, and at each time she asked for a sterilization and they said, no, you didn't file the paperwork on time. No, this is not possible this time. And they never told her, oh, it's a Catholic hospital and we don't do that. So it wasn't paperwork. She just never had that opportunity. And finally, and in fact, wasn't even realizing that it was a problem of the rules of the institution. She thought, how could I have missed this paperwork again, as if it's her fault? So yeah, people, we don't make systems easy, and then we're very quick to judge people and blame people when they're unable to access care.
It's really an eye-opening, and I think also just the opportunity to reflect on this, right? We hear certain sound bites and we talk about the policy and all of this, but there are real human dimensions to what stands in the way and how people access, and it goes beyond, do you have physical access to facilities, but so much more even before that. I think I mentioned to you, Diana, that we have a great set of guests joining from around the world. We actually have about 18 or 19 countries who are joining us today. And while I know a bulk of the longitudinal study has been, to date, has been conducted in the US, you did lift up that the same types of studies are being done in 4 or 5 additional countries. And I'm curious if you're seeing some of the same insights or similar insights and implications that are more cross-cutting to lift up to some of our partners who are joining us from abroad.
I worked with scientists in 5 countries to just document the hardships in accessing care in countries where it was legal. Abortion is legal, and yet many people are unable to access care. And I think it is extreme, though our findings are pretty universal, that people are making careful decisions about their bodies, about their lives, about their responsibilities. And that universally, even in places where abortion is legal, access can be quite difficult. I think it is important to make sure that we have representation from many countries, that we don't just use data from the United States. And these scientists, we made a short film about it, which I can try and put a link to, but called In Their Own Words, to let some of the quotes from people, like a young woman in Colombia who, knowing that she wasn't going to be able to get an abortion, said that this was her last chance to be young, that she was viewing this as a loss of her youth. And then other people who just, a woman in South Africa who recognized that this was not her fault that she was being denied an abortion, that in fact, that she felt it was the government who was forcing her to get what she called a backstreet abortion. That the obstacles that were being put in place were so great that she was going to resort to getting an abortion outside of the medical system. So yeah, I think, and then most recently, I've been working with an organization called CREPA in Kathmandu, Dr. Mahesh Puri leading a study of women seeking abortion from across the entire country, following both those who receive and those who are denied abortions. And Nepal is such an important context because maternal morbidity and mortality is extremely high. And their abortion law is one of the world's best. It is available up to 12 weeks at no cost at public facilities. And then for liberal reasons after 12 weeks for people with mental health and physical health and other conditions. And yet many abortions happen outside the legal context. So even where the laws are all right, the systems in place are not yet conducive to people to everybody accessing care. And Dr. Puri and his amazing team have been following the people recruited for this study to look at what their the physical health, their mental health, and their economic well-being is in a country where, we found in the United States that we could measure that the impact on the existing children when their mom was denied an abortion. We could see that their existing children were more likely to live in poverty and that they were less likely to achieve developmental milestones. So whether a woman who is not ready to have another child brings another child into the household affects the well-being of their existing kids. We see that in the United States. In Nepal, where it's possible that those effects will be even greater because child poverty and child malnutrition are even more dire there than they are in the United States. And so this is important work to show the international universal experience of, and also that everywhere people are able to make their own decisions about their bodies. And that I don't know yet what we're going to find in terms of longitudinal findings in Nepal, but I will be very interested to see whether in a circumstances where resources are so constrained, whether being able to dictate the timing and circumstances of your children makes a difference to the family's well-being.
So this piece on, the collective body of evidence, and it will be very interesting to see the results and learn more about the shared experiences and perhaps the unique experiences through the research abroad. I'm curious, when you're talking about this with others, right, with policymakers, with advocates, with research community, et cetera, what are some of the things that you're lifting up? And I raise that because so many of those who are on this meeting, on this call, are on the front lines of advocacy, and we want to lift up what you think is really going to stick and what needs to be at the forefront of these conversations.
I'm going to cheat, and instead of answering your question, I want to ask you a question first, and then I'll get a really good answer by hearing yours.
Fair enough.
I've mentioned the importance of focusing on individuals' ability to make decisions for themselves, and I wonder if you think that framing is going to be important in other countries, whether this new, I think it's new, focus on bodily autonomy and the validity of individuals' decision-making is a good framing, and also what research you think should be done to support providers, advocates, and policymakers in other countries.
Well, thanks for putting it back on me. I think the piece on individual ability is absolutely one very important part of it. But I think, for me, what is especially stark from your research and your book is the greater impact on women and on their families and their communities when agency and autonomy are not respected or respected, supported or not supported. And so, of course, I think this piece on individual ability is core and fundamental, and the individual rights and access. But I think we've also got to perhaps enhance that with that longstanding impact piece on societies, on community, economic empowerment, equality, and more. And that is still part of the conversation. And I raise that because, and this might sound a little doldrum, but I think that there's a whole faction out there that could care less about our individual rights as people and as women, or are really intentional about trying to diminish them. So I think we've got to go at this from multiple angles and diverse angles, so our arguments are evidence informed and also undeniable. As far as research, I'm also going to invite our guests to take to the chat and complement my own share. And Eliane, if you could post that question on what research do we wish was being done to support providers and advocates and others. And I think on my wish list is something that you're doing right now is country-based research like the Turnaway Study outside of the US, and really exciting again to see that's underway. And also that you're doing it in collaboration with research teams and universities that are homegrown in country. As far as other questions that are on my wish list that either maybe need more evidence or where evidence and research maybe could come forward much more visibly are, I think, the impact, both short-term and long-term, of unsafe abortion on communities, knowing that this is the leading preventable cause of maternal death and morbidity in the world. We've heard from colleagues in various sub-Saharan African countries tell us that if we had accurate and recent country level data that showed deaths and morbidities as a result of unsafe abortion, it would make a big difference in their policy advocacy. I think another space is the self-management of medical abortion and early pregnancy. I think that's huge for access, and it removes so many barriers that women currently have, and of course that you've lifted up and dug deep into in the study. And so adding to the evidence base around safety, autonomy, outcomes, when women no longer have to jump through these hoops to defend what we want and more. And I think that would be really powerful. So I think all of these areas certainly are really top of mind for me. And I'm going to go to the chat and see what others have noted here. Oh, there is a question, so maybe we can tackle this in the Q&A piece. So yeah, these are some of the areas that really stand out, and I think the conversation is important, right? As you and I have talked about, for research to be responsive, as well to meet the needs of advocacy and fill policy gaps, and at the same time recognizing that sometimes we've got to get the attention in really different ways.
Yeah.
So building a little bit on this conversation and some of the learnings to drive evidence uptake, and really my last question for you, and I'd like to open up to the audience, so please be posting some of your questions online, is this piece on how can those who are researchers in this sector and those who are advocates, how can we be working better together? What is useful? Where do you see the gaps?
So I feel like all my best research ideas have come from, not from within myself, but from talking to others who are working with patients or who are working with people who want to be patients. So for example, this whole Turnaway study started when I was speaking to the director of the abortion facility in San Francisco associated with my university. And she said, I wonder what happens to the people we turn away. And it was news to me that we turn people away. It just hadn't computed that, of course, these restrictions are resulting in clinics turning people away. And another example is, but not in abortion, is I was talking to someone else who had taken their own IUD out. And I didn't know that was possible, but it is. And so I've subsequently done quite a bit of work on whether people can remove their own IUD and how it might improve satisfaction with the method and, you know, increase people's autonomy. And thirdly, from my own experience actually, is in the United States, we give people one pack of pills at a time and expect them to have continuous use, even though we're giving them out in the smallest doses and making them return to a clinic or a pharmacy every month or every 3 months. And so I realized we could study this and look at whether people are less likely to be pregnant when they become pregnant, when they're actually given a whole year's supply and not required to go through a big process to stay using birth control. And so there just needs to be a lot more communication. This Turnaway study was inspired by a political conversation. Does abortion hurt women? And restrictions on abortion made on the basis that abortion does hurt women without considering whether lack of abortion hurts women. And so we were bringing the science to a policy debate. I think actually the next step, and that I certainly haven't done well yet, is to let this be a two-way street with advocates to hear what is most pressing on the ground. I tend to be able to hear physicians talk about their experiences or policymakers talking about their concerns. And so probably we need to open this up and allow for more dialogue in both directions and not just expect the research to trickle down to the field, but for the field to inform what research is being done.
You know, with that, I'd love to open it up to the audience and see what questions we have here in the chat. I'm going to scan real quick. Diana, you're getting some nice shout outs here. Let's see. We have a question about.
I noticed one. Can I call one out?
Yes, please do.
Francois Girard has posted about something that happened in the 15-week ban, the Mississippi case that went to the Supreme Court, that one of our Supreme Court justices suggested that the solution to the problem of unwanted pregnancy is that women should deliver a child and place it in a safe haven spot, like a police station or fire station, for their child to be given a place for adoption, and that this was the solution. And it's so shocking, this suggestion. It absolutely callous about the risks of pregnancy and childbirth. To suggest that that is any kind of easy solution is crazy. I mean, we see actual people die of delivery. It's not a simple solution to insist that somebody carry a pregnancy to term when they're not actively trying to make a baby. It's a risk we all should choose to do because we want a child, and not something we should subject people to who do not. And the other point is that in the Turnaway Study, very few people who were denied abortions actually opted to place their child for adoption. That just, even after delivery, very few people were willing to do that. It's not seen as easy. It's not seen as emotionally uncomplicated. It has all sorts of social implications, and it's just, it will never be the solution because people will never choose. It was fewer than 10% of people chose to place their child for adoption. So it is just not going to be the solution that most people will choose. Yeah. Sorry.
We also,
but I saw that question and really
feel
strongly.
Yeah, no, this is great. And there are some additional comments here. There is a question on how are mental health conditions, and this is from Douglas from Tinada, affect family planning uptake, and how should we be responding? Does it create barriers to access for overall family planning, I guess, might be the questions here.
Certainly the prime research goal of the Turnaway Study was to look at the mental health consequences of abortion. And we don't find any evidence that receiving a wanted abortion causes mental health distress. There is some evidence that being depressed makes it more likely people would choose to have an abortion. So if you have, and consistent with the law in several countries, is that there are mental health exceptions. If your mental health is at risk, then you should be able to get a wanted abortion. And there's some evidence that people who have mental health conditions are more likely to choose abortion over birth when they become pregnant. There's even some evidence that they're more likely to become pregnant. That may have to do with access to healthcare and ability to navigate contraceptive use with a partner. So yeah, I think there is a really complicated interaction of mental health and family planning, and it isn't one that is easily solved by governments making clear decisions that have no mental health or that don't allow individuals to make their own decisions. Any ban at a certain week is going to disproportionately hurt people who are vulnerable, including those with mental health problems.
I want to share a comment that's coming from a colleague in Kenya who has gone through your study and just noting that in Kenya, abortion is illegal, and therefore unsafe abortions are at a high level, and girls are really resorting to traditional forms of abortion, which are life-threatening. And this is what our colleague is seeing firsthand, who joined us firsthand, given her work directly in local communities, that is really devastating, and notes girls in communities I work with even actually prefer getting STIs, et cetera, to pregnancy due to stigma around early and unplanned pregnancies.
Yeah, and I think another person also mentioned stigma. We have such stigma around unintended pregnancy. Sometimes that has to do with cultural norms and around marriage and sex, and sometimes it just has to do with, when a topic is difficult, we just want to blame the people who are affected in order to other them and say, oh, well, this isn't a problem that would affect us. Let's just, this clearly, if we don't like abortion, then let's just say it happens to people who aren't good. And I guess that's part of having a family history of people with unwanted pregnancies, is that in no way am I willing to say it's a problem that other people face and not anyone like me. In fact, it's very universal, and stigma is a big part of why, it's hard to get people to come forward and say how important abortion is to them, because it's clear we would look down on them for sharing their experiences. And in the United States, when people have come forward to tell their abortion stories, we've actually seen that they've been then targeted for harassment online. So it's not, stigma is part of the problem in why we haven't solved this already, is that these norms that keep people from sharing their experiences and showing how universal it is.
Yes, and Shaikat from Bangladesh had raised the stigma question as well. And to your point, here in the US, 1 in 3 or 1 in 4 women have had an abortion. Yet the piece around, yes, the stigma on unplanned pregnancy, but then also the stigma associated with accessing, seeking, actually having an abortion also dominates. Rebecca, my colleague actually at PAI, has said if you would be willing to talk a little bit, or you talk a little bit in the study about the role of male partners and the role that male partners play in decision making. Yeah. Her question, did you note any difference in abortion versus adoption decisions? As abortion is a decision women can legally make for themselves. However, adoption has the added barrier of a partner having to consent to give up rights or to have those rights terminated after a period of time.
So we do ask a lot about relationship with the man involved in the pregnancy, and we find that often, about a third of the time, the pregnant person says it's the relationship with that man involved in the pregnancy that's her reason for seeking an abortion, that these relationships were not doing well to begin with. And we see that regardless of whether the woman got the abortion or had a baby, the relationship with the man involved slowly dissolves. We see continued contact for people who are unable to get an abortion, so much that we see higher rates of violence from the man involved in the pregnancy for the people denied an abortion compared to those who receive it. And this question, we find also that men are quite involved in the decision to have an abortion. So it's not often women choose to involve the man in this decision. So it's not unique, abortion versus adoption, that the man is only involved in the latter. Often he is involved in the decision to have an abortion. And unfortunately, adoption is so rarely chosen that I can't tell you the role of men in that decision, because it doesn't happen enough for me to be able to analyze those data. So I think that I suspect that it is that the decision to place for adoption or not is largely the woman's, because it is her physical experience of giving birth that may make the difference for her. But I think it's an interesting question, and I don't have the answer to how men are involved in that decision. Mm-hmm.
All right, I'm seeing if there are any other questions, some great comments here. Well, let the conversation continue, right? It doesn't end here. And I think the more we have these discussions in our own circles and as many external circles as possible, the better off. And we could continue this conversation for hours and days, but we are coming to time. And I hope, Diana, we can have you back in person at our offices in DC, or perhaps international gatherings where colleagues and partners can engage with you in person and directly. On behalf of PAI and our network of supporters and collaborators and friends, I want to thank you again for your work and for your contributions that have really helped inform, inspire, and fuel our work and the work of so many who are advocating for access to abortion, contraceptive, sexual and reproductive health and rights overall. To help close out today, I was hoping that you could do us the honor of reading a paragraph from your book. Whichever one which you think really captures and is going to end us on the right note for this conversation. So I'll hand it back over to you.
Wonderful. I'm going to paste a link to a video. It's available in French, Spanish, and English, I think. No, with subtitles. It's actually in many languages from the Global Turnaway Study. So this is what happens to people who are denied abortions in other countries. And now I will try and read a little from the book. This is the Turnaway Study. We find no evidence that abortion hurts women. For every outcome we analyzed, women who received an abortion were either the same or more frequently better off than women who were denied an abortion. Their physical health was better, their employment and financial situations were better, their mental health was initially better and eventually the same. They had more aspirational plans for the coming year. They had a greater chance of a wanted pregnancy and being in a good relationship years down the road. And the children they already had were better off too. Abortion opponents often accuse women of seeking abortion of being misinformed, irresponsible, or immoral. In fact, the Turnaway Study results make clear women make thoughtful, well-considered decisions about whether to have an abortion. And skipping a tiny bit, the Turnaway Study brings powerful evidence about the ability of women to foresee the consequences and make decisions that are best for their lives and their families. Thank you so much.
Well, thank you. On that note, we so appreciate you, Diana. Thank you to all of you who've joined us today. Please all stay healthy, be kind to each other, and let's keep lifting each other up to keep fighting the good fight. Have a great day.
Thank you.